Family planning is very important to an average Nigerian because the more babies you have, the more challenges you are likely to have. Go to the Western world, 2-3 children is actually what they have most. But in Africa, we have this love for large family. You can see a woman having 7 children, 11 children. That increases the morbidity and chances of having problems in terms of turbulent pregnancy experience. We can't tell that you get pregnant when you plan to, and that's what family planning does for you. It helps you to plan your family. It helps you to space your childbirth. It helps you to recover from the effect of one pregnancy before you carry another one. It also helps those children to have grown, to reduce dependence on you when you are pregnant. You see a woman who is still breastfeeding a child who is already pregnant, and you see the other one that she has already that is about 1.5 years or 2 years. That one is still dependent on the mother. Within a period of like 4 years, you will see a woman that has had close to 3 children. And so when you are having that, you now wonder, why do women age very early? They cannot establish and progress in their career because of short inter-pregnancy interval. Some women have not recovered from the effect of one pregnancy before getting pregnant again. So they begin to have anemia in pregnancy and more disorders in pregnancy. Having so many children, how much money do you have to take care of these children? So you should be able to plan. Planning of the family is very essential. Some of the myths some people have that makes them tell you that family planning something they should do away with is because some people will tell you that they believe that they will start adding weight when they do family planning. That is not true. And you should note that technology in medical side is also improving. So we have very beautiful forms of family planning agents you can have with little or no side effects. Now as we speak, people are beginning to have self-administrable family planning agents that you can inject yourself with at home. Cyanopress, for instance, is one you can inject yourself at home. People are now developing apps on the phone. You can access app for family planning and easily get it available for yourself to plan your life and plan your family. Other things we are now talking about is male involvement in family planning. Most family planning clinic, when you get there, majority of the nurses are female. Only will you see a male nurse there. So by the time a man is following his wife to clinic, the way they will be there is this one not a busy person. But by the time you have another man who can interact with you, you have better. Then in addition to that, we have also coined the fact that adolescents also have sexual needs. And these adolescents, we tend to give them dual form of contraception, because sexual activity in that age, they want to experiment and they have more sexual activities. So you are not just interested in preventing pregnancy, you also want to prevent sexually transmitted infection that can jeopardize their reproductive tract later in life. What are the different modern methods of family planning? You can have something we call subdermal implants. Subdermal implants are implants that are put in your hand. There are different types. You used to have something we call no plants, where you have about 8 rods or 6 rods put in your hand, but things have changed. Now we are just having only 1 rod or 2. And this rod, if it's just one, that can spend 3 years in your hand. You can plan your life. If you want to get pregnant prior to 3 years, you can remove it. If you want to delay till 3 years, you can abrogate another one that has 2 rods. You can put the 2 rods when you are ready to get pregnant, because that one lasts for 5 years. You can remove it and you have fast return back to fertility. So it's not that you remove it and you now have to be waiting and waiting. No, we have other agents like the intrauterine devices, which are now different types. There's one that we call hormonal IUD. When you insert it, that's one people tend to complain that it gives them heavy menses. Some people will tell you they have cramps and all that. But there's another one now that we are talking about. We are talking about Mirena, we are talking about LNGIUS and so on, which can be inserted. Once this is inserted, it starts releasing very little quantity of hormone, progestogen, into the uterus. It relaxes the uterus. For those who have terrible menstrual pain before, this, because of the effect of the hormone, menstrual pain resolves completely. Those who are C-class, they benefit a lot from the use of this IUD because it prevents sickling of their cell and also thins out the endometrium, causing them to have scanty menses, reducing anemia for them. Do you know that if you have fibroid and you are having heavy menses, hormonal IUD will be a good choice for you because it will make your menses thin and you will not have heavy menses like you always have. If you are above 40, you don't want children again, I will advise you go for a permanent family planning. Family planning is something we call bilateral tubal ligation, in which we tie the 2 tubes. But some people will tell you, what if my husband is now appointed as Minister of Health or Minister of Finance? and I want to have a child. If I pipe my tube, how will it be reversed? So we advise that people like that can do long-acting reversible contraception. An example of these are the ones I talked about. The subdermal implants, injectable, can have different types of injectable. There's one you can take once in 3 months. There's one you can take once in 2 months. Now, a point of emphasis I will make. Some people will tell you withdrawal method is working for them. Withdrawal method is like traveling through express, and when you are traveling through express, your eyes is closed and you are crossing express. You may be fortunate that the trailer may not be coming, and you may cross the express and the trailer may come. The same thing happens when you do withdrawal method. It is known that prior to when you feel the urge to release, there are some pre-ejaculatory secretions that come from the penis, and this quantity contains millions of sperm. So it is said that failure rate for withdrawal method is as high as about 40% in some instances. Family planning methods do not cause cancer and they do not cause illnesses. The first thing you do when you go to a family planning specialist is that we will evaluate you, and in the evaluation we want to find out, do you have history of cancers in your family? Breast cancer, cancer of the cervix, cancer of the endometrium. We want to find out, do you have migraine in your family? We want to also discuss, are you obese? Do you have hypertension? Are you diabetic? All these questions will be asked. So we'll now look for a very good family planning option that will suit you, and we'll now display that to you, tell me about it, and you can access it. So a good family planning expert would have evaluated it to see which one suits you before you are offered. So it doesn't cause cancer. I will advise that you find time to visit the family planning clinic where you can access care and plan your family better.